All right, so I am centering myself. I am providing privacy to my client and I'm hand washing. So before I walk in, again, I'm just asking myself, what am I about to do? Am I going into the right patient's room, making sure that I have all of the right equipment for what I'm about to go ahead and complete? I'm assessing the situation before I approach the patient. So I'm doing an environmental scan, looking for any safety hazards, and also doing a general survey of my patient. So my patient is presenting. He is comfortable lying in the bed and he is cooperative, and so he is not violent by any means. So I walk in and I will introduce myself. So, hello, my name is Nicole, and I'm a first year practical nursing student from Georgian College. I am going to be caring for you today. I understand that you have come in because you had some shortness of breath. Oh no. Well, before we kind of get started, I'm just going to ask you to repeat your name, please. Great. And can you remind me of your date of birth? Awesome. So I'm also going to be checking that and comparing it to the patient's chart and also their ID bracelet. So I hear that you have been coming in. You've been having some shortness of breath for some time now. Is that right? Yeah. Are there any other concerns? Okay. Well, thank you for sharing. Let me give you some information as what you're going to be expecting from me today. So first, I'm going to be asking you a few questions, and then I'm going to be moving on to our assessment piece of it. So what that should include is an inspection. So I'm going to be looking at your lungs from the front and also from the back, and I'll be touching the front of your chest and also the back. You're going to feel me tapping onto your back and also listening to your lungs. Okay, so the questions and the assessment together should take about 10 to 15 minutes. So before we move on, I would just like to let you know that everything that we share and that we discuss with me will remain confidential. So I will write it down on a piece of paper, and then all of that information will go directly into your chart. So it's only going to be shared with those who are part of your circle of care. Okay, I also want to remind you of your rights. So you do have the right to stop me at any time, pause at any time, ask me any questions if you have any questions, and even decline the procedure if you're really not comfortable with it, okay? Do you understand what we're about to do today? And do you have any questions for me? Do I have your consent to begin? Great. Okay, well, let's get started.